It's World Diabetes Day today, and this year it comes during a global pandemic.
Diabetes is the second deadliest disease in South Africa. And to make matters worse, people with diabetes are at risk of having more serious cases of COVID-19.
Let's discuss this with Dietitian and Diabetes Specialist Omy Naidoo, who joins us via Skype. Omy, thank you so much for joining us this morning. We've been aware for some time now that diabetes is a massive health issue, a crisis really in South Africa. The pandemic, the coronavirus pandemic, has brought that sharply into focus, because we then quickly realized that those living with diabetes are in probably the highest risk group in terms of how COVID-19 could affect them. What kind of advice have you been giving those of your clients who are diabetic during this very difficult last few months?
It's a very good morning to you and your viewers. Yes, indeed, it's been a very challenging time with COVID-19, and especially for our chronic patients like our diabetics. But what we've been advising is, if ever there was a time for good glucose control, it is now, because the data is quite clear that poor sugar control actually increases the risk of poorer outcomes with COVID-19. So with our patients, we've been calling them up more frequently for follow-ups to check in on how their sugars are doing, but also trying to get patients to not divert any sort of medical follow-ups that they do have. Because what we're finding is that patients are sometimes afraid to come back into hospital for their follow-ups, but in doing so, they actually are missing quite a few medical emergencies.
We're seeing at the bottom of our screen at the moment, Omy, that type 2 diabetes is the most common. If you can just explain to us, just briefly as you can, type 2, my understanding, is essentially the lifestyle type of diabetes. It's bad diets, it's a lack of exercise, just generally not looking after yourself. I imagine, and correct me if I'm wrong, it's that type 2 diabetes which we have in this country because people have very bad eating habits. Is that correct, Omy? Type 2 in South Africa, the most common. And how do people try and avoid going into type 2 diabetes?
Yeah, so you're completely correct that type 2 diabetes is by far more common. And it falls into the category of what we call chronic diseases of lifestyle, meaning that there is a genetic component to the type 2 diabetes. There are certain patients that are more susceptible, but at the end of the day, the big contributing factor besides environmental is also the lifestyle and diet. So the level of physical activity a person may have, as well as the type of foods they eat and the level of obesity that is within them. So the more obese a patient is, the higher their risk of developing lifestyle diseases. So those three that are lifestyle diseases are diabetes, hypertension, and elevated cholesterol.
Is part of the problem, Omy, that something like type 2 diabetes, that can eventually become far more serious, is something that South Africans, or just people in general, of a certain age start paying attention to? I look specifically at my age group. I hit 42 years ago, and these are the kinds of things that all of a sudden you realize your peers are talking about. Is it too late by then to take a hold of what might be a slippery slope to type 2 diabetes and what follows after that? And is there a need for better education for those lifestyle habits and eating habits to be better from a much younger age?
So each year with World Diabetes Day, often the theme that sort of follows through is better awareness. So the estimate is approximately 4.5 million South Africans have diabetes. But the scary part is that there's a further up to 2 million people that are diabetic walking around undiagnosed. So importance is awareness. But I'd love to answer your question and say that from the age of 45, you've got to do a screening and you've got to look out for symptoms of diabetes. But the scary part is that I'm seeing it in my everyday practice where even younger kids are having what we call insulin resistance caused by obesity. There was a study done by WITS, and it showed that South African kids in a decade were gaining weight at a much more rapid rate versus any of the other countries sampled on the continent, showing us that in time to come, the childhood obesity is going to be driving a much larger incidence of diabetes in the country, as if it wasn't large enough as it is.
Yeah, exactly what I was about to say is that it is the diabetes, particularly in children. Sorry to cut you off, Omy. I do want to get this question in before we disappear from you. We're talking about childhood diabetes. I've heard this excuse before, Omy, and help me understand. The cost of eating healthy in this country is exceptionally high. So it's easy to default to their cheap takeaway food with all the sugar and all the salt. And I've actually heard friends of mine who are parents say it's just easier to buy this snack on the way home. And I imagine because of the cost of food in this country and the ease of and the access to fast food, that must be a major contributor to type 2.
And before you answer that, Omy, the question I've often had, I've been lucky enough to travel to countries in the East, and the thing that I've noticed there in terms of the sugar content in their snacks that's available there, you immediately taste that their chocolates, their treats and all of that have far less sugar in it. And then you start thinking that perhaps is why they don't have such a large issue with obesity in that part of the world. Where is the issue here? Is it regulation? Is it government mandated rules that we need in terms of sugar and salt levels inside these kinds of foods that's available? What is the problem here?
I think that's quite a complex but multifactorial component. We've seen it last year where government introduced the sugar tax, and with time to come, we're hoping to have some sort of positive impact on the obesity statistics in South Africa with the introduction of that. But there's not a time that I don't sit with the client or patient and budget doesn't come up in terms of, what can they afford, what's accessible. And often it is perceived, or it is often easier to grab a takeout that's not the healthiest. But this is where I always urge people to connect to a dietitian, whether it's in government or private, because we can help in sourcing better options. If you are eating out, what's a better option versus the traditional ones that you're going for? Is it better to try and think, maybe I'll do that on the weekend as opposed to every weekday as well? So it's just about trying to find the balance. But I think it is definitely a budget perception, and there are ways to incorporate healthy foods without breaking the budget.
Omy, just a final question to you before I say goodbye. We're now starting to hear in the past couple of weeks, in fact the last couple of months to be fair, this term of long COVID. Obviously we're talking about Diabetes Day, but we are obviously still in the midst of COVID-19. What is the link between being diabetic, either type 1 or type 2, and long COVID? As Marcel said at the top of the interview, it is one of the highest risk factor groups when you got diabetes. Does this play a role in this now called long COVID?
So what it does is that with diabetics, they tend to have a higher degree of inflammation in the body. So inflammatory hormones like insulin and various other inflammatory hormones are elevated often in diabetics. And that then weakens the immune response. And in turn, you end up having a diabetic having COVID symptoms for longer sometimes, but also taking longer to recover. With some of our patients, not just diabetic, non-diabetic as well, even 3 to 4 months after COVID, still battling to do basic tasks like walking up staircases, walking for more than 5 minutes at a time. So there is definitely, we don't have enough literature out as yet, but there is definitely a long-term effect of COVID sometimes on especially the lung function.
Okay, we're going to leave it there. Thank you so much for your time this morning. That is Omy Naidoo, is a dietitian and diabetes specialist. Is also a director of a nutrition wellness institute with their head offices in Pietermaritzburg.